Assalamualaikum. My name is Dr. Sumaira Abbasi, and today we will be discussing about the overview of skills in interior cranial fossa. So, basically, the first of all, the introduction. The skull has 22 bones, excluding the ossicles of the ear, and except for the mandible, which forms the lower jaw. The bones of the skull are attached to each other by sutures, and these are immobile, and this forms a cranium. The cranium can be subdivided into two parts, an upper dome part and the base, and a lower interior part. So basically the upper dome part is calvarium, which covers the cranial cavity containing the base. The base that consists of the floor of the cranial cavity, and lower interior part, it is basically the facial skeleton of its located. The bones forming the calvaria are the paired and unpaired bones. The paired bones include the temporal and parietal bones. And the unpaired bones are frontal, sphenoid, ethmoid, and occipital. So now the bone which forms the facial skeleton are paired bones and unpaired. The paired bone includes the nasal bones, palatine bones, lacrimal bone, zygomatic bones, maxilla, inferior nasal bone, and unpaired is bone. The mandible is this part of the skull, which is not the part of the cranium, right? It basically forms the lower jaw. So this is the upper dome part, which is basically the calvaria, which covers the cranial cavity. This is the facial skeleton. And a base of the cranial cavity, which we will see in further right. So now the norma is basics. First of all, there's a frontal norma, which is norma frontalis, which you can see from front. So it includes, it has a frontal bone, and it has, so it has frontal bone. Then you can see some part of zygomatic bone over here. Then there is this nasal bone. Then there is maxillary bone. This is maxilla, right? Now, in norma frontalis, there is superciliary arch, which is just above the orbit. Then there is glabella. Glabella is the point where the point in between the orbits. Then there is nasion. Nasion is the point where both the nasal part of the nasal bone meets. Then there is in nasal bone, then there's this part is the frontal process of the maxilla, right? In maxilla, and there is intraorbital foramen, which is just below the each orbit on right and left side. Then this is the nasal crest, which you can see from the at the back. And this is interior nasal spine. And this is the alveolar process. Alveolar process is which provides the attachment to the teeth. Then there is enzygomatic bone. This is zygomatic bone, right? This is zygomatic process of the frontal bone, and this is zygomatic process of the maxilla, right? Now this is here. There's the ramus of the mandible, and this is the angle of the mandible. These are the mental foramen, and this is the mental tubercle, and this is mental protuberance. Now the norma verticalis, which you can see from the above. It includes frontal bone on each side. This is then there is parietal bone. Then on the back you could see occipital. This is occipital bone. Now there are two sutures. This is one is the coronal suture, and which is in between the frontal and the parietal bone. And the suture in between the occipital and the parietal bone is the lambdoid suture. This is a bregma. It is the point where the coronal suture and sagittal suture meets. And this is sagittal suture in between the two parietal bones. And this is lambda. It is the point where the sagittal suture and the lambdoid suture meets. Now the normal lateralis, which is visible from the lateral side of the skull, it includes again, this is frontal bone, this is parietal bone, this is occipital bone, this is the temporal bone, this is sphenoid bone, and this is zygomatic bone, right? And the some part of mandible is also visible, and this is maxilla, right? Maxillary bone. So here, here the important point is pterion. Pterion is a point where the occipital, frontal, sorry, except for the occipital or the all the four bone meets. This is pterion. It includes the frontal bone, then parietal bone, then this is squamous, the squamous part of the temporal bone, and this includes sphenoid. These four bones meet here over at a point which is known as pterion, right? So now this is norma occipitalis, which you can see from the back. The norma occipitalis includes the part of parietal bone, and this is occipital bone, and the temporal, this small part of temporal bone is visible, which basically the mastoid process, and external occipital phase, then there are further parts of the occipital bone. Now the norma basalis, which is basically the basal part or the base of the skull, it includes this, the occipital bone, then this whole is the temporal bone. The squamous part of the this whole is the temporal bone. This is the sphenoid bone. This is the humor, and this is the palatine bone. Even inferior nasal aperture corner are also visible, and this is the palate. Now the cranial cavity. The cranial cavity is the space within the cranium that contains the brain, meninges, proximal parts of the cranial nerves, blood vessels, and cranial venous side vessels. It has three parts: interior cranial fossa, middle, and posterior cranial fossa. The interior cranial fossa is basically composed of frontal, ethmoid, and sphenoid. The middle cranial fossa is composed of sphenoid, temporal, and parietal. And the posterior cranial fossa is composed of sphenoid and parietal and temporal and occipital. The roof of the cranial cavity is basically the calvaria. It is a dome-shaped roof that protects the superior aspect of the brain. It consists mainly of the frontal bone interiorly, the paired parietal bones in the middle, and the occipital bone posteriorly. From interior to posterior, there is a midline ridge, which is frontal crest, and the And there's a superior point of termination of the frontal crest, the beginning of the groove for the superior sagittal sinuses. This is the frontal crest, and this is the groove for superior sagittal sinus. And this is the bryma where the carnal and carnal suture and sagittal suture meet. Then there are some smaller grooves which are created by various meningeal vessels. In cranial cavity, as we have discussed before, there are three fossas: anterior cranial, middle cranial, and posterior cranial fossa. So this is the lateral view of the cranial fossa showing the contained brain regions. It contains the frontal lobe of the cerebrum, temporal lobe, and cerebellum at the back. Now the division of cranial cavity is this anterior cranial fossa, middle cranial fossa, and this is posterior cranial fossa. Thank you.